It was 1986 when I joined Bhandari Hospital. I used to work in OT and also took care of Madam's cabin. Then I joined BHRC. They supported me and I became a supervisor. They helped me a lot. I don't know how to read and write. I am illiterate. But sir and madam have been there for me.
In a nation like India, with a population of more than 1.2 billions, providing integrated medical and healthcare services to each person is a tough task, as the ratio of doctors per person is relatively low as compared to other developing countries, and moreover, lack of skilled specialized medical practitioners and paramedical staffs is further less. In this country, where 80% of the population resides in villages, the government has tried its best to provide latest medical technology and facilities, supported with adequate infrastructure, resulting in most of the hospitals being equipped with the state-of-art technologies. But there is a giant paucity of skilled persons to work on these technologies to assist the doctors and deliver maximum output from such a vast pool of resources. As it is well said, that revolutions begin with a bunch of few people who comprehend the need for change and determine with faith in their heart to triumph over every intricacy, thus leading the world to a promising tomorrow. On the same wavelength, Dr. Vinod Bhandari, who understood the need of changing times, started Bhandari Hospital in decades of 80s and afterwards laid the foundation on Bhandari Hospital and Research Center in the 1993 with an aim to provide quality healthcare services to common man. Not only this, but he also recognized the need for skilled manpower in medical and healthcare sector and laid the foundation of basic training for medical and healthcare service professionals.
मैं जब MBBS पास होकर निकला और मेरी इंटर्नशिप कंप्लीट हुई, उस समय मेरे पास कोई भी जॉब भी नहीं था और मुझे इंदौर रहना बहुत ज़रूरी था। तब मुझे महसूस हुआ कि हमको अपना खुद का डेवलपमेंट, खुद की स्किल डेवलप कर कर आगे बढ़ना होगा। तो मेरे साथ जो लड़के, जो बाइयाँ काम करती थी, उन सबको हमने खुद ने ट्रेनिंग देकर फिर अपना एक 50 बेड का अस्पताल परदेशीपुरा में चालू किया। उस समय जब ये हॉस्पिटल चालू किया तो मेरे साथ यही स्टाफ और नया स्टाफ जुड़ता गया और हमने मध्य प्रदेश में पहली बार पैरामेडिकल कोर्सेज चालू किए। उसको दिव्य अहिल्या यूनिवर्सिटी ने सर्टिफाई किया। पूरे देश में यहाँ के बच्चे, स्पेशली अरविंदो मेडिकल कॉलेज, भंडारी हॉक ग्रुप्स के जितने भी इंस्टीट्यूशंस अभी काम कर रहे हैं, इनके यहाँ पर जो भी बच्चा ट्रेंड होता है उसको पूरे देश में, देश ही नहीं, कुछ लोग तो विदेश में भी जाकर अपना जॉब कर रहे हैं या अपनी खुद की क्लिनिक चला रहे हैं। मैं जो भी बच्चा पॉवर्टी के कारण, गरीबी के कारण जॉब कर रहा होगा और आगे पढ़ाई नहीं कर पाया होगा, उसको हम 8वीं, 10वीं, 12वीं या कोई डिग्री करना होगा उस लायक बनाएंगे। उनको वोकेशनल कोर्सेज कराएंगे जॉब में ही रहकर, और वो जिस गांव के होंगे, जिस शहर के होंगे, जिस जगह रहने वाले होंगे, उसी शहर में उनको हम प्रोजेक्ट बना के देंगे और वहीं पे काम करने के लिए ट्रेनर्स बना के भेजेंगे जो कि उसी एरिया के लोगों को ट्रेन करें, स्किलफुल करें और अच्छी हेल्थ सर्विसेज पूरे मध्य प्रदेश में पहली बार और फिर पूरे देश में दे सकें।
We had started the skill development program from Indore, Madhya Pradesh, and training at various levels is being done. Our motto is to run this program at national level and generate skilled manpower to get employed at various levels in various national as well as international organizations. Through their proper dedication and experience of 2 decades, Bhandari Group of Hospitals and Institution is presently conducting many vocational courses, training programs and hands-on workshops.
I am Dr. Harish Soni, working with Bhandari Hospital since last 20 years. I joined the hospital as ICU doctor, and in the last few years, I have learnt a lot of procedures through training program and gradually improved my skills to become senior ICU in charge. I have also trained around 150 junior doctors in intensive care, and now these doctors are doing well in the nearby rural and suburban areas. Along with this, I also trained the students of physiotherapy. I have learned a lot in these years, and now, in my role as a senior intensivist, our management has played a major role in improving my skills.
Under the flag of Bhandari Group of Hospitals and Institutes, now we have well-known medical institutes like Bhandari Hospital and Research Centre, Mohak High-Tech Specialty Hospital, along with educational institutes like Sri Aurobindo Medical College and PG Institute, Pharmacy, Management and Engineering Institutes. Equipped with latest medical facilities and state-of-the-art technology, these medical institutes receive influx of patients not only from Madhya Pradesh but also from throughout India. In our medical centers, every day on an average 3,000 patients are finding cure to their ailments. On the other hand, Sri Aurobindo Medical College and PG Institute, Sri Aurobindo College of Dentistry, Sri Aurobindo Institute of Management, Sri Aurobindo Institute of Technology, Sri Aurobindo Institute of Pharmacy, Sri Aurobindo College of Nursing, and Sri Aurobindo College of Allied Health and Paramedical Sciences are training close to 5,000 students in medical and other professional courses. The institute started with paramedical courses in the year 1997. Today, we are in 2013, and rarely anybody would have thought that in such less time, Bhandari Group of Hospitals will start with more than 250 courses. Today, the institute provides super specialized courses in various medical fields of cancer surgery, gastroenterology, pediatric surgery, reproductive medicine, and urology. Not only medical, but the institute also runs post-graduation in different fields of dental, engineering, pharmacy, and physiotherapy. Our journey is not limited to creating a generation of well-trained doctors, but we also believe in giving strength to various pillars of medical and healthcare services by imparting paramedical education and training. It is the result of our efforts that today, under the flagship of BGHI, Sri Aurobindo Medical College and PG Institute provides training to doctors, nursing staff, medical technicians, and multi-level healthcare professionals. As a result, newer dimensions to healthcare and humanity services are being added every day, and we are still moving ahead. In the second decade of 21st century, when the super specialty medical science is at its top, Bhandari Group of Hospitals and Institutes established Mohak High-Tech Super Specialty Hospital and Laparoscopy Academy of Surgical Education and Research, LASER, thus making a place in India as well as abroad.
I am Rajendra Shrivastava and I joined Sri Aurobindo Medical College in 2004. Initially, I used to assist in general surgery and then onwards assisted orthopedic, ENT and gynec surgeries. I was trained in laparoscopic technique and assisted in laparoscopy. Earlier our salary was less, but with the time and condition improved, and now I am able to provide better education and quality of life to my children.
LASER is the biggest of its kind, animal tissue wet lab and dry lab facility available in this part of the globe to train laparoscopic surgeons as well as laparoscopy surgical assistants and technicians around the year. In this phase of super specialities, where the need to fill the gap between advanced medical technologies and skilled technicians is felt across the length and breadth of healthcare sector, we are providing innovative training systems on latest technologies to concerned technicians, thus paving the way for the youth looking for employment opportunities.
My name is Dinesh Prajapati. I joined Bhandari Group of Hospital in 1989 and it's been 25 years of association. Dr. Bhandari sir himself made sure that I learn X-ray technology and he supported me a lot. I have gained a lot in life in terms of learning as well as quality of life for myself and my family. And I am proud to be associated with this group.
Not only medicine, but dentistry, which is seeking huge transformation, owing to introduction of newer materials and techniques, requires a variety of skilled personnel like dental hygienist, dental lab worker, and ceramic worker. We build up more than 200 skilled professionals every year to serve the nation in dental sciences.
My name is Hitendra Patil. I joined as a dental mechanic trainee and over the period of time I learned acrylic and metal dental processes work. I'm also training 10 dental ceramic assistants every year with my skills. And even the dentistry students receive our help. I'm in a better condition now. My skills have improved over a period of time. I'm very thankful to Bhandari Group of Hospitals for honing my skills.
In the field of physiotherapy, Bhandari Group of Hospital and Institutes has been providing training and services since more than 2 decades, and we have so far trained maximum number of physiotherapists and occupational therapists in India, catering to the needs of various class of patients. At present, more than 300 general duty and more than 50 OT technicians are enhancing their skills by attending the training sessions provided by us. In pathology and radiology, faculty at Skills Development Academy under BGHI is imparting excellent teaching over high-tech machines and interpretation of results to lab technicians. Medical and healthcare services are hard to imagine without a highly skilled nursing staff, and in the last 20 years we have provided nursing and A&M courses in a well-woven theoretical and practical environment.
I am Nanda Hinge and I studied only till 10th grade. Initially I used to work in BHRC OT, but later on joined chairman office, and now I am the supervisor for hospitality here and training others too. This is what makes me happy when I am able to impart my skills to others. Plus, I am also getting a chance to.
Our Skill Development Academy left no stone unturned in training personals from various levels of healthcare services, including the ward boys, midwives who were unfortunate in PAT and deprived of even primary education. We not only trained them with their skills, but also educated them so as to maximize their efficacy and value in any system.
My name is Lakshmi Yadav and I passed 12th in 2011 but couldn't complete my studies further due to financial reasons. Dr. Shilpa ma'am joined me in her team as IVF helper. I also learned to operate ultrasound machine, and with her guidance I completed my nursing studies and further training. Today I can communicate and orient others about IVF technique.
Be it doctors or nursing staff, OT technicians or radiology assistants, at every level and in every corner of medical and healthcare services, our Skill Development Academy under BGHI has given equal emphasis to skillfulness, perfection, experience and civilized approach, the 4 pillars of this sector. Therefore, training today's youth towards a bright future will make way for a better India of tomorrow. Talking about our tomorrow, let's imagine that day when a person sitting in some far-flung village who even today is deprived of skilled healthcare personnel and better medical facilities will be able to reap the benefits from an excellent combination of information technology, skilled healthcare personnel, latest medical practices right at his doorstep.
I am Venkatesh. I am a physician assistant. I joined this institution 2 years back. When I applied a job in this institution, nobody knows who is a physician assistant. But now most of the hospitals in Indore knows who is a physician assistant just because of the opportunity given by this institution to me at that time. They trusted me and they given me the opportunity which made a marked difference in my life so far. I am working as a cardiac surgeon assistant in this institution, which I am very proud of.
To deliver world-class training at every level, biggest requirement is a world-class infrastructure. Bhandari Group has a digital lecture theatre, surgical demonstration room, e-content development cell, and state-of-the-art multimedia and animation facilities to make learning more conceptual and interactive. Along with the world-class infrastructure, experienced trainers, and practical facilities, BGHI is proudly affiliated with FAMES Institutes and Council. We are keenly devoted in building skilled manpower to serve the nation in the healthcare sector and making healthcare services a better experience. We scale with speed to skill.